My God, how wonderful. 40 years of help, of joy.
There were 4 of us originally who were, as you say, the cast of characters. Jean Sonville, Marge Gravatt, Ike Reed, who was a pediatrician, and myself. And really, the idea or the need came out of the scene on Coventry in the 60s, where young people, the counterculture, were doing their own thing, didn't trust the establishment, of which we were part. We needed something more than a stopgap, because the kids were in dire straits, but I think would rather succumb to the drugs than to visit a medical institution.
The 70s were a wild time all the way around, and the free clinic really reflected really the attitudes of that time. We talked people down from bad drug experiences on the back porch, and the separate rooms of the house were different rooms where we did exams and stuff, and we actually worked very hard to get equipment in that house so that we could see people appropriately. It was chaotic, it was noisy, it was happy. I just remember that being a very joyous place. We worked hard.
Well, it's very unique. I will tell an anecdote about the first night. We thought we were very well prepared for the opening of the free clinic, and we're pretty focused in on, I would say, hallucinogens, marijuana. And the first night we had 30 patients, and 24 of them were heroin addicts. And in all this preparation for our opening night, no one had ever thought of heroin. But we reacted fairly well to it, I think. But I always remember that as everyone saying, heroin? We're going to have heroin addicts here? This isn't what we were going to do.
We became more visible to the broader community, and we started seeing families, so that the average age of the person we served, which might have been from the early 20s, quickly it became, the average age was the late 20s, and we began seeing, as I said, families and children, and the array of problems, medical problems that we saw expanded.
We were a group that was put together through the efforts of the Cleveland Foundation, with funding also from the Gund and Weatherhead Foundations. And over the years, my brother David Roth was executive director for approximately 10 years.
The mission of the free clinic is really twofold. First, we seek out underserved populations who require medical care, and we reach out to them and try to bring them into our clinic to receive the care that they need. And secondly, we advocate on behalf of people who don't have health care coverage in order to really try to move society to a place where everybody does have health care coverage.
Over the last 40 years of our existence, a clinic that went from being one where we served people who walked in off the streets with problems as varied as the common cold or really severe mental health issues, to one now where we serve people who come in by appointment.
It was a refreshing place to volunteer because everyone had the same goal and everyone really pitched in, and no one was turned away. Anyone who walked through the door, no matter what their problem was, got some type of service. And it was exhilarating, actually.
My story is a long one. Began nearly 7 years ago now, when I was released from prison after a 14-year stay for having a car accident. Part of my release was to complete a drug and alcohol program. which was at the free clinic. Fortunately for me, because it has led me down a road of everything from surgery and podiatry and mental health counseling when I lost my son.
The vast majority of every dollar we get goes toward program needs. You know, we serve people for primary medical care, dental clinic, behavioral health, HIV/AIDS work. We've got specialty clinics that we provide whenever we can get the volunteers to do it. And so, we're able to put the vast majority of every dollar that comes in toward those programs. We couldn't do any of what we do without some really important partners. The hospital systems have been historically very supportive. For example, right now we get virtually all of our lab work done donated through the Cleveland Clinic Foundation. Before Cleveland Clinic, St. Vincent was doing that. Before that, University Hospitals did it. So, they've always been very helpful in helping us with our lab work. We get volunteers from all over the community. Our volunteer component, we couldn't do what we do now without that partnership. And we probably do, in terms of the total hours that are devoted, probably about 2 to 1 staff to volunteers. But that third of the time that we get from volunteers, obviously, this model couldn't work without that kind of volunteer support.
If there's anything at all wrong, you're called immediately and asked to come in again. I don't think you get that if you have good health care. But without the funding that they raise and bring in for each and all of us, I wouldn't have any of these medications. The thing I want to say about the clinic is the gratitude that I, as well as other people that I've met there, feel. The people there are so responsible. They care. And this isn't just a pretend care, they care.
My belief in supporting the free clinic is not only as a board member, but the belief in health care for everyone.
I wouldn't have known where to start to get any of these things done had it not been for the door being open to me. Not much else I can say other than thank you.